Hey everyone, I'm Sarah Lavonne and I am here today to talk to you all about vaginal exams. What are we checking for when we perform a vaginal exam, how to understand exactly what that means, and then how to make the vag exam just a little bit more comfortable for you. All that and more, let's get started. A-E-I-O-U, it's hot. Whew, Lordy. Okay, something that you can expect when you're pregnant and going sometimes to your doctor's office or you're in labor and you go to the hospital is for a doctor, nurse, or midwife to reach inside your vagina and feel to the end of your vagina and then find your cervix in there. I have the saddest middle finger. Ignore the terrible looking fingernail because I literally just picked off one of my gels. By the end of the day, they'll all be gone. I'm gonna speak as your nurse because I am a nurse, and so what am I checking for when I reach inside somebody's vagina? First of all, I'm trying to find the cervix. So when I reach inside, I eventually will hit the end of the vaginal canal. If I'm just kind of feeling around and nothing ends up hitting me, then I haven't found it yet. When I find the cervix, I'm gonna first of all try to find a hole. Basically, that's all it is, right? Because the cervix is the base of the uterus, and eventually it's gonna open up and let the baby down into the vagina. So I'm feeling for some sort of hole and or the baby's head. Now, if I feel the baby's head right there, then I'm calling a doctor and getting somebody in there for delivery because most likely you're getting very, very close. So when I reach inside your vagina, I'm feeling for three things. One, I'm feeling for where the baby is at, as far as high in the pelvis or low, kind of like right there sitting in the vagina. The other thing I'm checking for is the thinning of your cervix or effacement. And then the third thing is what everybody talks about, and that is going to be your dilation. So how open is the cervix or how dilated is the cervix? So let's talk about effacement for a little bit. Effacement is gonna be the thickness of your cervix, which you want to be very thick when you are pregnant, but come time for your baby to be born, you need it to thin out to almost paper thin. When you think about effacement, you wanna think about the thinness being the more stretchy that it is. Another word that we use is ripe. You want the cervix to be ripe and juicy and soft because you're never gonna put a baby through something very hard, right? You need it to be soft and smooth and able to open up. So when we're feeling for that cervix, it's graded on a scale from 0 to 100%. 0% being totally thick and then 100% being paper thin. Typically, a first-time mom is going to thin out before they open up. Whereas for a second-time mom, it really doesn't matter. Sometimes you'll dilate before you thin out and vice versa. That thinness is going to be graded from 0 to 100. I do actually have 10 rubber bands here. So these are ponytails. And each one of these 10 is going to represent 10% of the thinning. Now, when I have a fully thick cervix, it's gonna be really hard to stretch these and dilate them, right? Workout. As time goes on and as your body either gets ready for labor or is in labor, you're slowly but surely going to thin out. So now I'm about 10% effaced. The thinner that it gets, the easier that it gets to stretch the cervix, right? Up until you're about 80% effaced, 90% effaced, and then 100% effaced, super stretchy, right? That you can stretch this thing to 10 centimeters and get a baby through that. The goal is for you to go from 0 to 100%. Again, 100% just being super thin and stretchy. So that's the first thing that I'm feeling for when I reach inside. How thin is the cervix? The second thing is gonna be your dilation. So how open is your cervix? I have some visuals. I grabbed some things around the house and they're going to represent what each level of a cervical exam will feel like, okay? Now mind you, we're only talking dilation here. When I'm reaching inside, I'm feeling for a hole. That first hole, as it's just really tiny, I have a little it was a ginger shot from Thistle. All right, so I reach inside and I can only fit one finger inside. What is that? That's gonna be 1 centimeter. So imagine this way is kind of where you're looking with the hole, okay? 1 centimeter dilated. Not super dilated, there is no way you're gonna be able to fit a baby through that. 2 centimeters dilated is a little bit more. So I have like a little astringent here for my face wash. If I take off the cap, this is gonna be about a 2 centimeter dilated cervix. So I'm gonna reach inside, I feel, and I can shove my fingers in there, but I can't really totally fit them side by side. My finger is so sad. I'm not gonna shove my fingers in your cervix. I'm just gonna gently place my fingers into your cervix to see about how open it is. This is your 2 centimeter mark. For 3 centimeters, I have a bottle of probiotics, or say like a vitamin bottle or an ibuprofen bottle or something, which by the way, don't take ibuprofen in your pregnancy. If I open this up, I'm gonna look inside. This hole and opening is about a 3 centimeter cervix. So I can fit my fingers in there comfortably with a little bit of wiggle room. And then I need some more Himalayan pink salt crystals from Trader Joe's. So if I open this one up, oh my God. If I open this one up, the opening here is gonna be about a 4 centimeter cervix, okay? So now you can see my fingers are starting to open up a little bit. So that's about 4 centimeters. Now, when we're halfway there, I have this Burt's Bees hand cream. This hand cream was actually given to me by a former patient. So if I open it up inside and grab the cap here, I'm gonna reach here, and this is gonna be about a 5 centimeter cervix. 6 centimeters is my beautiful can of garbanzo beans from Trader Joe's. And the top of a can is about a 6 centimeter cervix. So notice, you're more than halfway from 0 to 10 centimeters. Now, 6 centimeters is kind of our magic mark. 6 centimeters equals active labor. More to come on that one. But when you get to 6 centimeters, that's when we would say that your body has kind of figured out what to do. It's in a rhythm. It's probably going to dilate pretty regularly after that. But prior to that, from 0 to 6 centimeters, we don't really care how long it takes. It may take a couple of hours, it may take 24 hours, it may take even longer. And sometimes even before you're actually in labor, you might go to the doctor's office when you're more full term. This is not early in your pregnancy, but later in your pregnancy, you might go to the doctor and they may check you and actually feel like, oh, you're 1 centimeter. Does that mean that you're in labor? No, it doesn't, because you need contractions and you need your cervix to be changing in order for you to be in labor. You're just really lucky that your cervix is changing without any kind of contractions or discomfort. Good for you. So once we hit 6 centimeters, now we start to get into the nitty-gritty time of labor. This is when it's really pushing, by pushing, I don't mean pushing. This is when it's moving forward and you're actually dilating regularly. You're really having to work through those contractions. You're needing to breathe through them. You might be requesting pain medications for them. So after that, your 7 centimeter cervix is my mason jar. So now when I reach in, I'm gonna feel a lot more of the baby's head here, but the baby still cannot fit through the cervix that way, okay? But we're getting much, much closer. My favorite one is coming next. I wish there was coffee in this. My Starbucks cup is gonna be my 9 centimeter cervix. So I reach inside and now I'm really having to stretch to figure out where the sides of the cervix are. There's only this, what we call lip, all the way around the cervix, or maybe just on one side of the cervix, but there's still something blocking your baby from coming down into your vagina. I'm really close. This is where it is very intense for your labor. If you don't have an epidural, you may feel the urge to push, because now look at where the baby's head is in that cervix, right? Prior to that, when it's only a little bit open, you could really, your baby's head can't fit in at all. Whereas now, when the baby comes down, look at how much of the head is really sitting in that vagina and maybe giving you the urge to push. And then last but not least, I have my favorite candle. It's my fall candle. Now, when you're 10 centimeters dilated, this is the moment that you've been waiting for. The baby's gonna fit directly down the vagina and now put extra pressure on your rectum. You feel the urge to push. Now, if you have an epidural, you may not feel that urge to push, or you might just feel like you need to poop. But either way, now there's nothing blocking your baby from coming down into the vagina and then pushing it out into the outside world. I'm gonna tell you a little secret, okay? When we talk about 10 centimeters, that actually doesn't mean 10 centimeters. All that means is that there's nothing in the way blocking your baby from coming down into the vagina and then pushing the baby out. Let's talk about the third thing that I check for when I reach inside. The third thing is what we call station, and this has to do with your pelvis. I have my handy dandy pelvis right here, right here. That's not right. The female pelvis. The baby is gonna be floating around in your uterus. It's not what we call engaged in the pelvis. Now, the closer you get to your due date, the more the baby is gonna settle into that pelvis and kind of get stuck there. Mind you, it's not totally stuck, but it's lodged in. So this is looking straight up her vagina. If I'm reaching in, you have all these bony prominences or bony pokey things poking out, right? What I'm feeling for is where this little prominence is, or this pokey thing called your ischial spines. When the baby is lodged into the pelvis, I'm gonna reach in and I'm gonna feel for those ischial spines in relation to where the top of the baby's head is. So the higher the baby is inside the mom, the more negative the station. Zero station is where the top of the baby's head is right at that bony part. Once the baby passes through and really gets stuck into the pelvis, I'm gonna feel that those little bony pokey things are way past the baby's head. So I'm gonna say the baby is in a plus station. The rest of this space from here where the bones end to where the baby actually comes out is when the baby is in your vagina. And that's when your vagina hole starts stretching. So your vagina hole is gonna be really small. And then as you start pushing, the baby is going to stretch out the vagina and stretch out the vagina until it is through. Once the head's through, the shoulders come through really easily, and voila, happy birthday, baby. Let me clarify something really quickly. When we talk about your cervix dilating or you dilating in labor, we're not talking about your vagina hole. Your vagina hole opens up once the cervix is 10 centimeters and no longer there. The baby has come down into the vagina, you've pushed a little bit, and then that we would just call crowning. Let me recap really quickly for you. When we do a vaginal exam, we're checking for 3 things. 1, how thinned out you are. 2, how dilated you are. And then 3, the station of the baby in the pelvis, or how high or low the baby is inside you. I know for a lot of women, vaginal exams are not fun. Maybe you're laboring without an epidural and you're feeling so much pressure to push, and the labor is all consuming. You don't want anybody else in the room. Your nurse comes in and says, we really need to check you. Why do we need to do that? The only way for us to know how to get everything prepared and or to call the doctor or the midwife in is by knowing with our fingers exactly what's going on inside. I know for a lot of women, vaginal exams can be very, very uncomfortable. So I have some tips to help to make your vaginal exams more comfortable. I don't know if they'll ever be pleasurable or something that you enjoy, but at least you'll know by the end exactly where your labor is at. What I would say is that you have to try and be as relaxed as possible. I know it's uncomfortable when you have a stranger putting their fingers inside you, but really just remember that for us, it is completely a medical thing. I can't tell you how many vaginas I've seen, and now it's all just one big vagina blur. Make sure that you take your time getting settled, taking some deep breaths, relaxing your pelvic muscles. What that means is that you're not tensing up your vagina, you're really loose and open. The other thing I would suggest you saying to your nurse is, can you wait until I'm ready? Really, the goal would be that anybody that puts their fingers inside your vagina would have permission to do so. So one of the things that I know I do is that I will say to the patient, is it okay that I check you? And I get a nod from them, and then I say, you tell me when you're ready. Because I think for the woman, it takes the second to kind of get in a mental space, especially if you're uncomfortable having contractions, to lay down, open their legs, relax a lot, and then I'm gonna warn you before I put my fingers inside you. I know that's not the practice of every nurse, but that might be a nice thing that you could talk to your nurse about when you're preparing to do vaginal exams or as you're getting checked in. This might be something that could go on a birth plan. It might be something that your doula could help you out with. But really, they should have permission to check you. When you're more relaxed, when you have that comfort level with your nurse or your doctor, whoever is checking you, then that vaginal exam is gonna be a lot more comfortable. I can tell you right now that for me, when I reach my fingers inside people, I have very small and very ugly fingers right now. It more matters about your demeanor going forward. So if you feel comfortable with them, if you're the one feeling like, yes, I'm giving you permission to touch me down there, and then if you can just relax those muscles and not tense them up, that vaginal exam is going to be a lot easier for you, and it's gonna pass a lot quicker for whoever's checking you because they're gonna be able to find your cervix a lot easier. I hope that answered all your questions about vaginal exams. If you have any other questions or comments or ideas for me in a future video, or maybe something that didn't make sense to you, please feel free to comment below. Until next time, thanks for watching. Vagina. And you want it to be thick because you want your body to keep your body pregnant until the time is right. You want your baby to stay inside. You want your body, oh my God. You're gonna be a lot more stretchy, okay? Now I'm at 50%, I lost one, 40%, and then say, that's not even right. Opening of your whole vagina hole is going to be where the baby has passed. That's just not at all what I want to say. Maybe you're laboring without a contraction. No, you can't labor without a contraction. I'll do that later. I hope that answered all of your questions. Nah, I don't know. Vagina. I hope that gave you a better idea of what to expect when we're doing a vaginal exam and exactly what we're checking for when we reach inside you. Thank you for watching my video. No. Thanks for watching.